Hello, Assalamualaikum. This is Ultrascan Diagnostics. This is the CBCD of Ultrascan Diagnostics.
The area of interest is basically periodontics, as the doctor has mentioned. We've got very severe periodontal disease in this patient. The upper right quadrant, distal to the second premolar and the second premolar itself. As you can very clearly see, very severe bone loss. We'll take you through each tooth quickly. So this is the second premolar. We've got bone only on the apical 1/3. The region of the sixth, again, very little bone, no bone for implant placement. And then we move on to the seventh. Again, very little bone present, as you can see, bone loss, even including the furcation area. And so hence the upper right quadrant is not doing very well in terms of periodontal health. This is the upper left first premolar. Again, you can see we've got a huge periodontal pocket here, but again, better than we don't see radiolucency, we don't see PDL widening. So hence we can say that there is bone loss here, recession here, but not as much. The upper right canine seems to be doing okay. The lateral incisor and the central incisor seem to be doing okay as well. Moving to the canine on the upper left side, again we've got a bit of abrasion. And then we move on to the first premolar, and this is a rotated first premolar. Here you can see that the mesial and the distal root is visible here. So this is the rotated premolar, which is suffering from severe bone loss. And on the transaxial view, you can also very clearly see that there is significant periodontitis associated with this tooth. Moving to the upper left 5, again significant bone loss and abstraction lesion. So these teeth are also in very poor periodontal health. The upper left first molar region, absolutely no bone. We've got sinusitis here as well. So no implant placement. We've got medias present. The upper left 7, again significant bone loss present, including the furcation area. So that is visible there. Moving to the lower left 7, good ridge. You've got D3 bone quality. 11 millimeters of ridge width with approximately 10 millimeters of height. Moving to the region of the lower left 6. The lower left 6 again suffering from bone loss, but not as significant as the uppers. This tooth, if periodontally cleaned, if therapy is done, this tooth can be restored and can sustain to stay. The lower left 5 doing well. We've got abstraction lesions, we've got a little calculus around it. The lower left 4, again significant bone loss, especially on the lingual aspect, with abstraction lesions as well. So this tooth needs a little bit of attention in terms of whether, if it is clinically mobile, we would advise extraction. The lower left canine, again significant bone loss, but no caries or no periodontal lesions. The lower left lateral incisor, again significant bone loss. We've got calculus on the central incisors in the lowest, again significant bone loss there. The lower right first premolar, we've got what seems to us a crack. So we definitely have a crack present here, which we can show you right here. So this tooth is cracked. So this will need our doctor's attention. The lower right second premolar is doing okay, good bone support. The lower right first molar region, again we've got a D3 to D4 quality bone, but this can sustain an implant. The cancellous bone is very significantly radiolucent, but the first molar and the second molar region implants can be placed, as we have measured the ridge, and the ridge is good and supportive of dental implants. So this is the axial view. You can see the significant bone loss associated with the lower jaw, and as we will show you the upper jaw, there we go, a significant bone loss associated with all the upper teeth as well, which you can see on the axial view as well.